Hi, Mr. Carrington. My name is Amber. I'm going to be your nurse provider today. How are you doing today?
I'm good.
Can you just state your name and date of birth for me?
January 31st, 1991.
Okay. What brings you in today?
Just a physical.
Just a regular physical, no complaints of anything? Okay. I'm going to assess you. I've washed my hands already so we can get started. All right. Any pain today or recently? All right. So I'm going to first start with just checking your face, making sure that it's nice and even, symmetrical on both sides. So can you look straight forward for me? All right, I'm going to test. Any pain anywhere? Okay. I'm just going to assess your scalp, making sure that there's no indentations, no discolorations, no lacerations, any openings or wounds or anything like that. Nothing that feels off. Do you have any headaches? Okay. Next, I'm going to examine your eyes and the acuity of your eyes. So I have a Snelling chart on our wall. It measures what you can see from 20 feet away and how well your vision is from 20 feet away. I have a piece of tape lined up on the floor. If you could stand up and stand behind that piece of tape, please. Now, Mr. Carrington, if you could read that first line for me.
E.
With one eye closed. I'm sorry, one eye closed?
Yeah, I got
Okay, you got your hand over your eye. Can you read the first line for me?
E.
Okay, and that next one?
FP.
Okay, and that next one?
TOZ.
All right, and that next one?
LPED.
Okay, can you read the next one?
PECFD.
Okay, are you able to read the next one?
Yes. EDF. CZP.
Okay, how about the next one? Okay, so I need you to cover that other eye. And I've documented that you can see down to line 7, no issue. And cover that other eye and just read to me that chart again. So we stopped a little shorter today. Now with both eyes, can you please read that chart? Oh, Snelling chart reading. You do see pretty well, but do you see an annual eye doctor for your eyes? Okay, just go back and make sure you're getting your annual exams and checking the vision of your eyes because there could be some deficits. Okay. So next, I'm going to check your vision and how well you see out of your peripheral vision. This is called the visual fields test. So this test is where I will have you cover one eye and I will put up a number and I need you to look straight at me and tell me which number you're seeing in each of the 4 quadrants that I'm going to be putting my finger in, okay? So, directly at me.
1, 2, 2, 1.
Okay, very good. You can uncover your eye. Again, look straight at me and tell me the number you see in each of these 4 quadrants.
1, 2, 1, 2.
Good. All right. Next, I'm going to test the strength of your eyes, your extraocular muscle strength movement. Okay? So, with the first test I'm going to do is called the Hirschberg test. The Hirschberg test, I'm going to have you look at my pen light and then follow it, okay? I'm looking for any deviations, any lateral deviations, anything abnormal. So just follow my pen light. Okay. Very good. And I didn't see any abnormalities in that. The next one I'm going to do is going to be basically have you cover and uncover your eye. I will tell you when to cover and uncover your eye. First, cover this left eye for me. And I'm going to have you follow my pen light. And I'm going to have you uncover your eye. And we're testing to make sure that your other eye isn't moving still when I ask you to uncover that eye. Okay? Now uncover the right eye. Didn't move on the other side when I saw you uncover it. I didn't see any twitching or any other movement. Now I'm going to do the 6 cardinal fields of vision. Okay? Movement. Where your eyes are going to move where I tell you to move them. Okay? So I just want you to follow my pen light. Look at me straight. Okay? Good. That's just making sure your eyes are moving correctly and properly in different directions that they're supposed to go. Okay? Next, I'm going to just press lightly on around your eyes to make sure there's no abnormalities. So if you can close your eyes and look down for me, I'm pressing lightly on the eyelids. Any pain here? Okay, bony prominences, the orbits, everything feels fine. Any pain at all? Okay, now can you open your eyes? Now I'm going to darken the room so that I can do some more tests to look inside of your eyeball to see how well your eye pupils are accommodating to light. Look at your in the back of your eye, we call it the ocular fundus. Okay, so I will turn off the lights. Now, Mr. Carrington, I made the room dark so that I can look better into the inside of your eye. Take a look at the structures on the inside. So from what I see, you have nice white sclera, which is the outer portion that surrounds your entire eyeball, really. And the cornea is the layer that is in front of the eye. Now, as I'm looking into your eye with my pen light, I'm looking for a thing we call perla. It means your pupils are reactive to light, and they're equal when I shine light in them. They constrict, which they both do when I shine light into your eyes. Now what I'll do is I'll look into your eye, each one, and I'll have you look around because I'm trying to look into the back of your eye. Very good. And I don't see any abnormality in this eye. Let's do this one. You look around for me. Very good. I don't see any abnormalities of the eye. Let me look down into your conjunctiva. Is nice and pink and moist. Any drainage or crusting, no pain. Very good. Okay, Mr. Carrington, now I'm going to assess your ears. Do you have any issue with the ear? Any built up, wax built up? Are you sticking anything in your ears? Good. And I will take a look at the outside of your ears first. So let's do this left one. Okay, I don't see any redness, swelling, no pain. Are you having any pain? Okay, good. No lacerations or anything like that. Now I'm going to look inside your ear. Okay, the canal is not occluded. I see the pearly white gray membrane. Very good, and it's all intact. Now I'm going to take a look at the other side. Now, Mr. Carrington, I have my tuning fork, and what this does is it lets me know how well your sensory neural is when it comes to both of your ears with hearing. So I'm going to strike this against my knee, makes a sound like this. I'm going to put it up to your forehead, and you tell me if it sounds the same, equal in both ears. We do this test to check if there's any sensory neural deficits in either ear, if you hear it more in one ear than the other. Just let me know, okay? Is it equal in both ears? Okay, very good. Now, Mr. Carrington, I'm going to do what we call the Rhine test, the Rinnen test. This is a vibration. I hit this against my knee. I'm gonna place it behind your ear, and you're gonna tell me when you hear the vibration stop. Okay, I'm gonna place it against what we call the mastoid bone behind your ear. Then I'm gonna put it up to your ear, and you tell me if you still hear it. Okay? You hear it now?
Yeah.
Okay, that is a normal test. Now let's do it on the other side. Next, I'm going to take a look at your nose, making sure everything looks good. From what I can see, the symmetry of your nose looks good. I don't see any swelling. I'm going to palpate here. Any issues here? Okay. Any pain, any issues with the sinuses? Now I'm going to take a look inside of your nose, okay? Okay, everything looks good. I don't see any bluish tinge. Nice and pink. Do you have any issues with discharge or your nose running? Okay, very good. Next, I'm going to take a look at your sinuses, because our sinuses are very important. Our sinuses are those cavities that are around our nose, above our eyebrows, and they are points of drainage. Sometimes we can have inflamed sinuses, or sometimes we could have a thing called sinusitis, which is inflamed but also with infection. So we've got to make sure we don't have any signs or symptoms of that. Do you have any pain or swelling at all? Any dripping in the back of the throat, which would be postnasal drip, things like that. So I'm going to inspect your mouth, and I already felt on your nose, and I'm going to just feel on these sinuses. I feel these sinus cavities. I don't feel any deviations or anything like that. I'm going to ask you to open your mouth, okay? And from what I can see, I don't see any swelling. I see the tonsils are still intact and still present. That uvula is midline. The tonsils are in their margins, not more than in their pillars. So I don't see any enlargement there. I don't see any redness or any leakage down the back of the throat. Buccal mucosa is pink and moist. Can I see your teeth, please? All teeth are intact. Gums are pink and moist. I don't see any issues here. Do you see a dentist regularly? Okay, very good. You have very nice teeth.
Thank you.
You're welcome. So I don't see anything. Can I look at the roof of your mouth if you can open up for me? Checking for any redness here. Nope, I don't see anything. I don't see any abnormalities. So I do want to check for your cranial nerves. Okay, those are nerves 9, 10, and 11. So the first one I want to check is I want you to say ah for me. Ah. Okay, and this is your glossopharyngeal nerve. It's tongue movement. Now, as you're saying ah, I would like you to swallow. Okay, any issues with swallowing, any pain? Okay, I saw that you swallowed, no issues. The last one I'm going to check is that cranial nerve 11. So I'm going to want you to push against my hand with your cheek on either side, okay? 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 Now I'm going to try to push your shoulders down. Don't let me push them down, okay? Okay, very good. Connecting your neck, and it is nice and symmetrical. No issues here. I don't see any discolorations. Everything feels good. I'm palpating. I don't feel any enlarged lymph nodes. I do feel that Adam's apple. I do feel that thyroid butterfly gland that's right here, and the cricoid process, which is the cartilage, is right over it. Okay, Mr. Carrington, now I'm going to assess your cardiopulmonary function. So, the first thing I'm going to do is actually, if you could please remove your shirt, and I'll provide you with a drape. The thing I'm going to do is just take a look at your chest. We call it our thoracic cavity here. And I see it's nice and symmetrical. I see that there's no asymmetry, so everything looks good on this. And now I'm going to just look at your lips and your nose. I don't see any nasal flaring. Your lips are nice and pink, which means that blood is perfusing through there nicely. Can I take a look at your hands? On the other hand, seeing how well we are perfused and hydrated, and how that finger is coming back to pink within less than 3 seconds. Same thing for the nail beds here. They are coming back very quickly, and that means that we're getting pretty good perfusion throughout our body, and no abnormalities are found with that. Now, I'm feeling the vibrations that go through your we call your windpipe, your trachea, and your clavicles in your chest, as well as the back of your chest, the front and back, to see if I hear any vibrations when you say the number 99. So I'm going to have you start.
99, 99, 99, 99, 99.
And I'll have you turn around in your chair, and I'll look at your back and do the same thing.
99,
And
99, 99, 99.
those vibrations every time you said 99, so that is good. No abnormalities there. I'm going to look at your chest expansion. So again, I'm going to put my hands on your chest, and I want you to take a deep breath, and I want to make sure your chest is expanding in and out, and by my hands moving. Good. Again, I'm gonna have you turn around in your seat so we can see that back. You can do that again for me. And now you can relax. What I'm gonna do is I'm gonna percuss each of your, what we call intercostal spaces, to make sure that I don't hear any dullness or decreased sound. That means that there could be some type of consolidation of the lungs that we wanna make sure is not happening there. Okay, so with percussion, I go and I check the areas. So I go down and I can use these fingers down to the second intercostal space as well. Okay, no areas of dullness. Very good. Now if you turn back around in your seat for me. And the next one I'm going to explain to you is called the diaphragmatic excursion, where we test if your diaphragm is moving up and down like it's supposed to with your respirations, okay? So what I'll have you do is you'll turn around in your seat. When you turn around in your seat, I ask you to breathe in and then blow, exhale as forcefully as you can. Hold that breath. And I'm going to mark an area with eyeliner because eyeliner comes out of the skin very well. It doesn't bother the skin. And then I'll ask you to breathe in again. Take a couple breaths, and then take your breath in and hold it. And then I'll mark where that when I percuss, just like I just did, to see where your diaphragm is sitting and how well it's expanding. Between those two markers, when I mark your back, it should be between 3 and 5 centimeters. If it is less than that, that means there's probably some type of thing we need to look further into as far as your respirations and your diaphragmatic movement. So what I'll have you do is turn around in your chair. And again, I'll ask you to breathe in and out, and then I'll ask you to breathe, blow out and hold your breath. Okay? Deep breath in, deep breath out. Blow it all the way out and hold. You can blow out now. Okay. Now again, I'll ask you to take a deep breath and blow out, and then blow out, and then blow in and hold this time. Okay. Okay. And take a deep breath in and hold. Take a good breathe now, clearly. Okay. So now I'm going to measure with my tape measure in centimeters. And I'm getting right at about 3 centimeters here. So that's within normal limits, no abnormality there. I'm going to do the same thing on the other side. Same distance for this side, I'm getting it at 3 centimeters, which is normal because it says between 3 and 5 centimeters is what we would expect to find. Okay, now, Mr. Carrington, I'm going to listen to your lungs, okay? I'm going to use the bell of my stethoscope first and just listen to this area here. Take a deep breath for me. Okay, deep breath for me. Breath. 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 And that would actually turn around and let you breath. Deep breath. Deep breath. Again. Deep breath. Deep breath. Again. Deep breath. Deep breath. Deep breath. Again. Very good. Everything. What we'll do is we'll also, I don't notice any swelling. Can I just check your ankles if you can lift your, no swelling. I don't see any swelling, which would be indicative of like heart issues with like maybe the heart not pumping, the blood out correctly or enough fluid through your system. Again, I can check your carotid pulses. And like I said, those are +2. Okay. Now, we have, our body has 6 major vessels, okay, that pump blood through our body. 6 major points, okay? Our carotid, our arteries, and both our arteries and our veins. So the veins bring unoxygenated blood back up to our lungs for oxygenation, to get oxygenated, and then arteries pump the oxygen-rich blood out to our tissues and our organs. So we definitely need to get the pulses that you have. So I got your carotid pulse. The next ones are going to be the brachial. Okay, that's going to be right at this brachial, this plexus here, going to go inward, and I want to feel that brachial pulse is strong, and I do feel it, and that's +2. Same on the other side, because we always want to make sure that they are equal. And right here. Okay. Next, I'm going to go down your arm, and I'm going to get the radial pulse. The radial pulse is the one that's closest to your thumb. Okay, so we're going to go down about this way, the line with your thumb. And that's going to be your radial pulse. It sits against where your radius bone is. Second, we're going to go to your pinky, go down here for your ulnar pulse. And that's also +2 and present. Okay, let's do the same thing on the other side. We're going to go down to your lower extremity pulses. So I will have you lift up your, to get behind your knee, because I need to feel what we call your popliteal pulse. And that's going to be the pulses behind your knees. Okay? And I will have you relax your leg, and you can relax it down on the floor. And I feel that, and that is a +2. Same thing on the other side is going to be dorsalis pedis pulse. So that's going to be going at right at your foot. So if you scoot back for me so we can see, all the way back. So that's going to be right, and you lift your foot up for me. So that's going to be right at the top of your foot. We're going to go down. And we're going to put your leg down. I do feel that, +2. Same on the other side. That same on the other side. And then your dorsalis pedis is going to be back here, right in the inner part of your foot, where your ankle is. And I'm just going to palpate that. That's +2 on that side. And the same goes for that side. You can rest your foot. Okay? And I'm going to check your capillary refill on your toes because we need to make sure that the blood is circulating to your toes because it's got a far way to go. That's the furthest way it has to travel. And if it's doing good there, that means it should be doing good at the rest of your body. So, see how the cap refill is on your toes. I'm pressing down. Good, less than 3 seconds. Listen to those valves that I talked about, those points of your heart, where you have pulsations, that have the heart working, those different parts and points there. I'm listening for things called a bruit. A bruit is like a swooshing sound, and that's not necessarily good. That's not a good sound. That means that there is some type of indicative problem that we need to address. I should only hear normal heart sounds. And that is an S1 and S2 sound. If we were to hear a swooshing or anything like that, that's indicative of a murmur or any other type of cardiac issue. So again, we're going to listen to the aortic valve, which is going to be that top right, the second intercostal space. Same goes for, we're going to listen to that pulmonic valve at the second intercostal space on your left side, Erb's point, at the third intercostal space, the tricuspid at that fourth intercostal space, and that mitral at that fifth intercostal space. Okay. This present. Here. Listening at Erb's point. Okay. Listening at the tricuspid. And then the point of maximal impulse is right about here at that fifth intercostal space. And I hear a regular S1, S2 heart sounds. I don't hear any bruits, any swishing. So your physical exam went well today.